Hello, good morning. I'm here once again to share a little experience. I'm not here to teach about mathematics, I'm not here to solve mathematics, but I'm here to bring to a notice there's a particular sickness, or will I say bacteria. We do hear of the name, but we might not really pay attention to what that particular bacteria is all about. The first time I heard of it, tetanus, I was wondering, is it an insect or something? But when I made my own research, I got to find out that is a particular bacteria that comes in contact with your blood through your wound. When you have wound and you fail to take care of that particular wound, the bacteria forms, and once it gets into the blood, is very, very deadly. And there's one other particular word I want you guys to take note about. It's called opisthotonos. Now, this opisthotonos is a particular sickness, though not common, but as a result of bacteria or fungi or any infection or sickness that is severe in the body, and once it gets into the brain, that particular individual starts showing signs and symptoms that you can't even explain. In Nigeria here, our normal sickness, malaria, typhoid, headache, things like that. But when that particular person starts experiencing symptoms that is not familiar with malaria or typhoid, but you know that it's something else. Now, what is opisthotonos? Is a state of hyper extension and spasticity in which an individual's head, your neck, and spinal column enters into a complete bridging or arcing when something is forming like an arc. Yes, an arcing position, and it normally affects the brain. What are the symptoms of this particular bacterial infection? You experience headache, you experience high fever, very, very high fever, sweating, increase in change of blood and your heart rate. And how do we come in contact with this particular bacteria? It can come in through your wound. If you have any injury and you fail to take care of it, or maybe you had an accident on your leg that has a big sore, or even a tiny wound, maybe you scratch your leg and you just ignored, it will heal on its own without taking precaution to take care of that wound. Once it forms that particular bacteria, tetanus, and it enters your blood, you might not even know that you have it until you start experiencing the symptoms. And it takes 3 to 21 days before you start experiencing those symptoms. And what is these symptoms when you know that this particular bacteria has already entered into the blood? The person will start experiencing a particular type of thing that most times people think is spiritual attack, or maybe they say maybe it's the person's village people that is after the person. But no, I had an experience that was last year. My daughter was sick, so we thought it was normal malaria and typhoid, whatever infection. Children, she started complaining, my stomach, my head, my leg, my mouth. Her mouth was having this type of odor. She said that teeth, different complaints. She can't eat well. She started losing weight. So after we ran the normal test, malaria and typhoid test, both medicine for her she took. After 3 days, it was not working. So I decided to take her to the hospital because she was running temperature. Once you are having a high temperature, high fever that is above 38 degree, getting to 39, 40. Once it's more than 40 or it's up to 40, you have to get yourself to the hospital because is a sign that there is something wrong in the body. That's the way the body shows sign that there is a particular thing wrong with your body, that whatever drug you have taken is not effective. So when we got to the hospital, they used water to mop her body. They now prepared a specimen that they wanted to give her an injection. So they tried looking for veins. They didn't see any. The nurse really tried. Nurse Felix, he tried. Then he got one tiny particular vein. Immediately he administered the first specimen of injection. She started reacting. How was she reacting? Her tongue was coming out. Her eyes, the black one, was not visible anymore. It was going up. She started twisting her neck sideways. I was like, what is this? Because she used her leg to walk down to the hospital. So how come she's now having this particular attack? So I didn't really know what was wrong. We didn't really know what was wrong with her. So they tried their best. She was really shaking. She was convulsing. It was later I got to know that it was convulsion. She was convulsing and having seizure. So the first day they administered drip into her body. The second day, the all the things they were giving her was not working. Her temperature was going up 40 degree, 41. Later it will come down to 39. It wasn't working. So the first day we got there, she had that seizure like 2 times. So each time she have the seizure, I'll shout, I'll call the nurse to come and attend to her. They'll give her another set of injection inside her drip that she was taking. So the second day, they did the same thing. Already she has started stooling and vomiting. Each time she takes anything, eats anything or drink, she'll start stooling. So then the doctor was not around. She was on her way coming. And when she got there, the nurses explained everything to her, how they started and all that. So when she had the seizure in front of the doctor, I was really shouting because I didn't get myself. I've not experienced something like that before. So even the doctor, she too was confused that what was going on. After all the treatment, this is the second day. It's like nothing is working. So she now she went to her office, and when she came back, she was like, did she have any injury of recent, like a month ago or maybe a few weeks ago? I said injury. I said anytime she has injury that I do normally use hot water, I use spirits, I use Dettol, iodine, but I can't really remember if she has any particular injury of recent that they should just check her body, because I was already tired and frustrated. So when they checked, she now said my child has tetanus infection. I was like, what is the meaning of that? She said she diagnosed her of op, op, what's it called? Opisthotonos. That whatever bacteria or virus that is inside her body, that it has gotten to her brain. That's why she's having those seizure and all those reaction, even the body temperature. So she showed me some pictures. I was like, no, my daughter's condition has not gotten to this. Last year she was already 10 years old, 10 years plus. So she said we are going to get what's it called, ATS, tetanus serum. So